Hi, I'm Dr. Mark Green with Kansas City Foot and Ankle. We're going to talk about a very common type of forefoot pain that we see here in the office, and that's called capsulitis. Capsulitis means inflammation, that's the itis part, of the capsule or joint capsule, the soft tissue that holds the toe to the foot. And the most common place to have capsulitis is just underneath the second metatarsal head, or on the bottom of the foot just behind the second toe. Right in this area. So if you have pain in the ball of your foot that seems to be localized to the bottom of the foot just behind the second toe, there's a good chance that's capsulitis. The most common reason that people get capsulitis is because of an overall instability in the way the foot is functioning. Okay, for example, the position that the foot should function in when she's standing is right here. Really nice arch. The first metatarsal bone is down. This is a good supportive position. In this position, the weight is balanced evenly across the bottom of the foot. But in someone who has a pretty flexible foot, when they step down, the first metatarsal bone elevates up quite a bit. Okay, so we should be in this position, but when she steps down, her foot elevates up like that. That causes the second metatarsal bone to bear more weight than it should. So with the first metatarsal bone elevated, the second bears more weight, and the joint can get very irritated. That causes inflammation in the joint capsule, capsulitis. Treatment options for capsulitis are twofold. Number one, we need to get rid of the inflammation and the pain. Number two, we need to address the overall cause of the problem, which in most cases is an overall instability in the way the foot functions. So number one, anti-inflammatory medications can help. There are topical medications that can help. There are oral medications that can help, such as Advil or Aleve. Sometimes we'll inject a little bit of cortisone right in that area, and that'll help calm the inflammation down. Different types of pads can also help. A metatarsal pad, for example, that puts pressure behind the ball of the foot can take the pressure off of the second metatarsal bone and allow the symptoms to subside. Long term, we need to keep the foot functioning in its most stable position. In other words, this position right here, keep the first metatarsal bone down and keep the pressure off of the second metatarsal. And the best way to do that is with orthotics. Custom molded functional orthotics are custom made shoe inserts that are made individually from molds of your foot to keep your foot in its most stable position. In other words, what we would do, we would take molds of your foot, manipulating your foot into the position that it's supposed to function in. We take that mold, we send it to the lab. When you get it back and you wear it, it's going to give you the exact stability and support that you need, keeping the first metatarsal down, maintaining a nice arch, balancing the weight across the ball of the foot, and taking away the pressure from this area right here. Orthotics are very successful in preventing capsulitis from continuing to occur. If you have forefoot pain, there's no reason to live with it. Come see us at Kansas City Foot and Ankle and let us get you back to your activities quickly and comfortably.